Do you know that about 10 to 20% of all pregnancy end up in miscarriages? And also 50 to 70% of these miscarriages are as a result of chemical pregnancy. Good day everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as a nurse with the difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be sharing with you the causes of miscarriages, causes of pregnancy loss, the signs and symptoms you should take note of, that the signs and symptoms that should give you a clue that this is a miscarriage. But before we go into details in today's class, if you are new on our YouTube channel, please click on the subscribe button, turn on the notification bell so you don't miss out. For all my returning subscribers, just know that you guys are the real champions. Let's go there. Alright, welcome back. Like I earlier said, today I'm going to be sharing with you the causes of miscarriages or pregnancy loss. The cause of miscarriage or pregnancy loss. But before we go, what is a miscarriage? A miscarriage is a natural loss of a pregnancy before 20 weeks of gestation. It is the natural loss of a pregnancy before 20 weeks of gestation. You may want to ask, what are the signs? What are the symptoms? What should I take note of when it comes to miscarriages? For you to know that a miscarriage is taking place or has taken place, the first is abdominal pain or cramp. When your abdomen hurts badly, when you're having that abdominal pain or cramp, that could be passing a message for you to see a doctor as soon as possible. Then the second is back pain. So if you are having back pain, that could also be passing a message. Then the third I have to share with you is vaginal bleeding. Vaginal bleeding. If you are pregnant and you are having vaginal bleeding, don't just sit down and assume it is okay. It is better for you to see your doctor at that moment. It is better for you to consult your physician, to consult your midwife as soon as possible. Then the fourth I have to share with you is pinkish discharge. So if you are pregnant and you are seeing pinkish discharge, and we know it's not implantation bleeding or something of such, it is better you see your doctor. Then the fifth I have to share with you is reduced pregnancy symptoms. If you are having nausea and vomiting, you're having breast tenderness or soreness of the breast, all of a sudden these pregnancy symptoms, they diminished. Alongside with these symptoms I've listed, that could be a sign of miscarriages. What I advise my viewers is always consult your doctor, always consult your physicians, always consult your general practitioner so they examine. It is better for them to say nothing is wrong than for you to assume nothing is wrong and something is wrong somewhere. So these are the signs and symptoms that you should look at for miscarriages or pregnancy loss. Then the next question you want to ask is, Nurse Mary, the main point of the video, what causes miscarriages? The cause of most miscarriages are not known because they come to the hospital and they lost the baby. Most time the cause of these miscarriages are not known, but we can pinpoint one or two factors that are responsible for miscarriages. The first I have to share with you is chromosomal abnormality, abnormal chromosome. I know you want to ask, Nurse Mary, what are chromosomes? Chromosomes are what makes up the unique traits of a baby. They are what makes up the unique traits of an individual. They are what determines your eye color, your hair color. These are what makes up that unique trait of that baby. So when there's an abnormality in the chromosome, that can result in miscarriages. This abnormality could be found in the egg. This abnormality could be found in the sperm, or this abnormality could be found in both the egg and sperm. So when there is an abnormal chromosome, it can result in miscarriages. An abnormal chromosome can cause Down syndrome and Turner syndrome. And babies with Down syndrome or Turner syndrome can end up also in miscarriages. With abnormal chromosome, you can have molar pregnancy or partial molar pregnancy, and these can end up with miscarriages. So in terms of chromosomal abnormality, it's not what is in your power to control. It is not what you as an individual can control or prevent on your own when it comes to natural pregnancy. So if you are conceiving naturally with a natural way, it is not possible to control chromosomal abnormality. But if it is through an in vitro fertilization, it is much easier to control it, because a biopsy will be done to detect all those abnormality. You can see the first cause of miscarriages I just shared was what? Chromosomal abnormality, and it is not in your power to control it or prevent it. Then the second cause of miscarriages is maternal medical condition, maternal health. What is happening to the mother? As the mother diabetic, as the mother hypertensive. Diabetes and hypertension can actually result in miscarriages. For example, a woman having irregular sugar level. Today the sugar level is normal, tomorrow it's high, next tomorrow it's low. This irregularity in sugar level, this irregularity as a result of diabetes can result in miscarriages. Same way hypertension can result in miscarriages. That is why whenever as a lady you go for your antenatal visits, antenatal care, they check your urine for sugar. They also check your blood pressure to know if you are having hypertension or not. And also another things that are likely going to cause miscarriages when it comes to the maternal health are fibroid. Yes, fibroid can cause miscarriages. It all depends on the size of the fibroid, the location of the fibroid, and also cervical insufficiency. Cervical insufficiency can result in fibroid. We all know that the cervix is the opening of the uterus. So when the opening, as the cervix is not in the normal shape, let me just use it in the layman's language, it's not in that normal particular shape that you're expected to see it, it's now wide open, that can result in miscarriage. So the maternal health can affect the baby formation. A mother that is having blood clotting disorder, that can also result in miscarriages. So when a woman is pregnant, they advise her to always go for antenatal checkup, to always go for antenatal visits. With that antenatal visit, they are able to check if she's hypertensive, if she's having fibroid when they do their scan and everything. They're able to detect this and help her manage her pregnancy effectively well. So that takes us to the third causes of what? Of miscarriages. The third cause of miscarriages is still under maternal health. For example, sexually transmitted infection. Sexually transmitted infection can cause miscarriages. I got this question from a particular viewer of mine. She was asking if infection can affect a pregnancy, and I said yes. So she finally asked me to explain why. I think this video will explain it but better. So sexually transmitted infection can affect the baby. Sexually transmitted infections such as chlamydia, such as gonorrhea, such as HIV can affect the baby. And also thyroid diseases can affect the baby. The thyroid gland is in the neck, and they help with hormones, some hormones. So when there is a disease of the thyroid gland, that can also result in miscarriages. Then that takes us to the fourth causes of miscarriages, which is the lifestyle. What is your lifestyle? Are you drinking excessively? Are you smoking? Are you taking illicit drugs? These three things I just listed, if it is part of your lifestyle, it can increase your chances of getting miscarriages. So if you know you want to get pregnant or you are already pregnant, it is advisable you stay away from smoking. It's advisable you stay away from alcohol, or totally limit your alcohol intake, and also stay away from illicit drugs that are not legalized in your country. It's advisable you stay away from those illicit medications or illicit drugs, not medications. So your lifestyle has a role to play when it comes to causes of miscarriages. Then the other cause I have to share with you, which is the fifth causes, is medications. So medications can cause miscarriages. Medications such as misoprostol. Misoprostol is an ulcer medication, and if you are taking misoprostol as an ulcer medication, it's advisable to withhold it when you are pregnant, because it can cause contraction of the uterus, and that can lead to miscarriages. Then another medication is the retinoids. Retinoids are people go for it because they have acne in their face, so it helps with acne. So if you are taking retinoids before and you notice you are pregnant, it's advisable you stop it. Even some NSAID, that is your non-steroidal anti-inflammatory drugs, these can cause miscarriages. So generally, I advise, if you are pregnant, before you take any medication, please consult your doctor. Before you take any medication, please consult your doctor, because some medications, when taken in, are likely going to affect your pregnancy. They are likely going to affect your babies. Then the last cause I have to share with you is food poisoning. Yes, food poisoning. I know you are thinking, how is food poisoning going to affect my baby? I don't used to eat anyhow. How is somebody going to poison me? Seriously, you can poison yourself by yourself. Sorry to use that statement. By taking the food you are not supposed to take. For example, Salmonella. This is gotten from poorly cooked egg. If you don't cook your egg properly, you can actually get this Salmonella. And also Toxoplasmosis. Toxoplasmosis is gotten from infected beef, infected meat. So these can cause food poisoning, can affect you, and can lead to miscarriages. So these are the points I'm here to share with you when it comes to miscarriages. And also take note of the fact that chromosomal abnormality is not what you can control. It is not your fault. It's not your lifestyle that you can easily control. So generally, these are the points I have to share with you when it comes to causes of pregnancy loss or miscarriages. So thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mary saying thank you. Bye, and see you in our next video.